Hello, this is John Kanellopoulos from our center in Athens, Greece, the Laser Vision Ambulatory Surgery Center. We're seeing a gentleman in his 40s with advanced keratoconus. He has past eye drops here. The other eye has less keratoconus, and if we look at the pentacam maps, these are from last year. We can see the big difference, the disparity between the right advanced keratoconic eye and the mild keratoconic eye. And this is our patient a year later following cornea transplantation, a penetrating keratoplasty performed in January of 2024. This is the beginning of 2025. Happy New Year from here, from Athens. The reason I'm putting this video together is to share with some of the cornea surgeons the way that I've come to prefer to remove sutures. So before that, I'm going to jump to this image, which is our cornea topography today. And it's always a guessing game which sutures you're going to remove and how much astigmatism is that hopefully is going to correct. So I go in with a 30 gauge disposable needle. I come in sideways, so there's no chance to injure the eye with a needle after a drop of topical anesthetic. I go in the middle of the suture, right at the graft host interface, and cut the suture here. And then, as we will see here, I'll pick up the edge of the suture on one side and the other side. It's been a year, so the suture may have started to become thinner with time. We're gonna see here the other suture that I chose to remove. Again, the same technique, sideways with my 30 gauge needle to cut the suture in half. We're gonna see a video here how I will use a special forceps to pull the needle quite fast. And it's very important to not drag pulling the suture, because you may end up amputating it and leaving half of the suture behind. So we're gonna see again here how it's a snap motion. You have to be very careful not to pull on the cornea. I've seen that in the years that I've been doing cornea transplants by a resident. And here we're seeing the two sutures removal, the change of the astigmatism from before and after. So there's a significant change in astigmatism. This is the change we achieved by the two sutures that were removed. And this is our basic technique of suture removal in a cornea transplant patient. Key thing to the quote-unquote success of the procedure, a patient is 20/25 with a -3 spherical equivalent, and the astigmatism has dropped from 6.5 diopters, as we can see here, the topographic astigmatism, to 3.7 with just removing two sutures. So doing a transplant is not enough. Taking care of the patients is also significant. This is the pathway to obtaining good visual function with cornea transplantations, although we have advocated for many years now, and we're very happy to see it as the clinical reality globally, that the best treatment for keratoconus is early diagnosis and intervention with cornea cross-linking. Our Athens protocol is practiced throughout the world by most clinicians who prefer to combine a surface ablation with cornea cross-linking. This is John Kanellopoulos from our center in Athens, Greece. I'll leave you with these beautiful images of a cornea transplant, the gift of sight from a family that mourns their lost one, but for a family that will now cherish this human exchange, and we're very proud that we're able to participate in this process as well.